I suffer from a schizophrenia. My first episode was psychosis when I was 21 years old. It seemed like every 5 years I would have a relapse. I had one foot in reality, one foot in psychosis, even though I was on medication.
In 2000, I was diagnosed with schizoaffective at Grady Hospital. It was kind of hard at first because dealing with the side effects of the medication. I had a lot of hospitalization because of a couple suicidal attempts. For a long time, I was locked up every year, literally every year. Either I'm in the hospital, either I'm in jail.
There's a larger group of the population that live with, depression and anxiety. But the people who really end up needing the most help are those living with psychotic disorders. They need intensive intervention, and they need it in the form of medications, in the form of case management, therapy. And Grady does all of those things in a comprehensive way that few other providers offer.
Troubles of the world. All right.
Grady Behavioral Health Services is the largest academic and community mental health center in the Southeast, administering more than 100,000 patient visits, consultations, and admissions each year, with cases ranging from opioid addiction to chronic and severe mental illnesses. The department employs more than 250 caregivers. One of those is Crystal, a certified peer specialist who has faced her own challenges with addiction.
I am also a person in long-term recovery from my mental health diagnosis and my substance abuse use. A lot of those resources that I provide to the patients here, I had to use those myself. A lot of the life skills that I help them with, I had to use myself as well.
Providing research, treatment, and community outreach for adults with mental illness, Grady has stepped in to fill a critical need.
Grady's behavioral health service line is really the last resort for people with serious mental illness.
I didn't want to go through the trauma anymore. I didn't want to put the stress on my family anymore. I wanted a successful life.
Oh man, I came a long way from talking to myself, thinking that Armageddon coming, to just a mellow head person, but I'm doing better. Grady was my lifeline, my last lifeline, to be honest. So, if it wasn't for Grady, I ain't no telling where I'd be right now.
Many of these positive outcomes can be traced back to Grady's integrated approach to behavioral health and primary care, a comprehensive approach that addresses overall wellness of the patient.
We have behavioral health clinicians assigned to each Grady neighborhood clinic, as well as the clinics inside the hospital. And then we have a psychiatrist as a part of that behavioral health team assigned. And so it's a win-win situation because patients then can get access to care right in their neighborhood and right in their medical care home.
We have many patients who come, for example, for medical care who say they first have a mental illness and are often, that's the immediate thing that first comes up, and are not even recognized to have other medical illnesses. And then I've said many times, just because you have something like schizophrenia doesn't mean you can't have appendicitis. But you'd be amazed at how many times people's abdominal pain is ignored because they simply reflect that they have a mental illness.
I wasn't a person who visited doctors other than my psychiatrist. I hadn't had a primary care in a long time, since a pediatrician. And so I wasn't aware that I was having physical ailments. And they found those at Grady, they treated them, and now I'm working toward 100%.
Patients are often feel a little stigmatized if they have to go to a psychiatric clinic. But if you walk in and it says health care or primary health, then they feel more comfortable and they can get the care that they need and follow up. They can come back for treatment and get their blood pressure monitored and also maybe deal with whatever they need for their depression.
Another area of success for Grady Behavioral Health has been the implementation of the Assertive Community Treatment Program, or ACT. Its goal? Care for the patient outside the confines of a clinic.
Instead of requiring the patient to come to us, we go to them. And so we'll see a patient wherever they are. That can be in a shelter, that can be out in the park. And so the idea, though, is that we really want to meet them where they are, introduce them to a behavioral health team, because it really is a team approach, and to follow them and help improve the quality of their treatment and the quality of their life.
We're changing lives, we're changing people.
I've become a peer specialist, and they've talked to me about actually working for the ACT team that I was a part of.
We have extremely skilled and talented people, doctors, nurses, case management staff, therapists, but most importantly, all of these people could be making more money somewhere else. They could have gone into a different field, but they're working with individuals who are hard to serve. They get spit on sometimes, they get kicked, they get punched, and they keep coming back to work every day, and they clearly have a passion for the people we're serving.
We're honored to receive this award for all the hard work that the members of the behavioral health team provide to patients and their families.
I also want to thank all of our partners in this, our great faculty, the tremendous staff at Grady, and our partners at Morehouse. Working together, we've created something that's unique and something that's truly special, and something that I'm very proud of.